Canada's universal healthcare makes it an attractive place to live. But it's not perfect. Not everyone has a family doctor, wait lists can be long, and the system costs more and more every year. So, can that system cope with tens of thousands of new immigrants every year? Well, the first thing to note is generally, new immigrants are healthier than Canadian-born residents. There's a phenomenon known as the Healthy Immigrant Effect. StatsCan tracked 500,000 immigrants over a decade and found that they actually had lower mortality rates than Canadian-born adults. So they need the healthcare system less, at least for the short term. That's partly because applicants are screened to ensure they're healthy and won't pose a burden on the healthcare system. If you might cause excessive demand on health or social services, you can be turned away. This might seem prudent, but there are questions about whether this approach might discriminate against people with disabilities. Disability rights groups point out that under those rules, Stephen Hawking or Stevie Wonder could never immigrate to Canada. They say the rules imply having a health condition means you have nothing to contribute. And those groups may have a point. The rules are less strict in the US and European Union. They also warn Canada's not living up to the UN's Convention on the Rights of Persons with Disabilities, which we signed. Unlike immigrants, refugee applicants can't be rejected because they have disabilities or have special needs. And in some rare cases, they can even be granted a refugee claim if their condition is a source of persecution, such as being HIV positive or having albinism. Now, if you're lucky enough to be granted immigration into Canada, congratulations. But beware, the country could be hazardous to your health. StatsCan noted the longer immigrants lived in Canada, the higher their mortality rate rose. Want to learn more about immigration and Canada's healthcare system? Check out our coverage at CBCNews.ca.